Your anterior cruciate ligament is a ligament that connects the tibia bone to the femur bone in the middle of the knee. It's the front ligament right here. It sits right in front of what's called the posterior cruciate ligament, which is behind it. And then on the side of the knee, there's the lateral collateral ligament and the medial collateral ligament. But this one between your tibia bone and your femur bone is your anterior cruciate ligament. Well, the anterior cruciate ligament provides stability between the tibia bone and the femur bone for rotation, for twisting stability. So when they injure their ACL, it's usually when the tibia bone or the foot gets planted, so the tibia bone's solid and the femur bone is still moving, it will twist on the knee joint and cause a rotatory injury that then tears the anterior cruciate ligament. The best way to treat an ACL is to prevent an ACL tear, and clearly there's data that has been done, particularly by out in California by a doctor who takes care of the U.S. soccer team, that if you train, he was taking care of the women, if you train but women or men in improving their plyometrics, their jumping skills, their hip, gluteal muscles and their quad and hamstring muscles, if you improve their core strength in all of those areas, that they have a significant decrease in their rate of ACL tear. Even with prevention, ACL tears are going to happen. I do feel that in the 20 years that I've been in practice, the incidence has decreased, and I think that's an indication that more people are doing better weightlifting. But when they do tear their ACL, the standard of care is to treat it with what we call an ACL reconstruction. In that surgery, we remove the old ACL, the torn ACL, which isn't functioning anymore, and we actually put in a new ACL. We use a graft that's either usually from the patient's own hamstrings or their bone tendon bone. Occasionally we use cadaver graft as well. And in that situation, what we do is we drill a tunnel in the bone that goes up into the knee joint, and then another tunnel into the femur bone and pass the graft into there. So we put in a new ACL where the old one was located. It is a lengthy rehab with ACL reconstruction. The first 6 weeks, we're concentrating on some strength and range of motion. By the 6-week mark, you usually have pretty good range of motion, and we really start working very diligently on getting strength back. And between 3 and 6 months, we start working on running, then we add cutting, pivoting into that, but it's not until a minimum of the 6-month mark until we can get you back to sports. And there's some data out there that we should maybe even be waiting closer to the 9-month mark. So somewhere between 6 and 9 month rehab for ACL reconstruction.